The topic for today is antioxidants stimulate BOC1-dependent tumor angiogenesis. This very important article upsets the proverbial apple cart, which we're known to do anyway. So we've come to accept that antioxidants are a positive feature in body hemostasis, and they are. However, there is a dark side. Recent research has shown that vitamin C and other antioxidants can stimulate the formation of new blood vessels in lung cancer tumors. This discovery corroborates the idea that certain dietary supplements containing antioxidants can accelerate tumor growth and metastasis. So it's worth looking at, folks. Let's have Dr. Gonshor go ahead.
Well, thank you, Reed. Hello, everyone. In each of these sessions, we take a deep dive into recent research that brings to light objective scientific evidence on the topic at hand. And today, we're looking more closely at antioxidants stimulate BOC1-dependent tumor angiogenesis. What does that mean? Well, researchers have found that antioxidants can activate a mechanism that causes cancer tumors to form new blood vessels, which is surprising since it was previously thought that antioxidants have a protective effect. So let's look at the actual evidence, because science matters.
Indeed, indeed. And so before we go ahead, Dr. Gonshor, with this important study, last week in our discussion of long COVID and the effects on mitochondrial DNA, there were a number of questions, of course, and one important one was, has the incidence of long COVID gone down with the rise of the latest variants? And if it has, why would that be?
Well, I think the first thing, and I remember we discussed it for a while, you and I, a little while back, and that is COVID still around? Have we sort of left it? And the answer is COVID is still around. And I think the latest evidence is about 1,000 people a week are still dying of COVID in the United States. And even more importantly, those with long COVID are still suffering, which we went through in our last broadcast. And I think that is something which needs to be addressed. But of course, for many of us, we left it long COVID behind, but it isn't. So there definitely have been changes in the incidence of long COVID. There was a recent article in the British Journal of Hematology that showed that the patient's risk of long COVID symptoms 3 months after infection dropped from about 46% with the original coronavirus strain and the Alpha variant to 35% with Delta to 14% with Omicron. For those of you who remember, those are the different names that we've given for the variants. And so the manner by which different viral variants infiltrate the body could be the key. Earlier variants seem to spread to vital organs more often than Omicron does. And so such spread might not always produce symptoms in acute infection, but it might make someone more likely to wind up with long COVID. So we know that with the Omicron variant, it does result in fewer long COVID cases because it acts differently in the body than the earlier strains of the virus. Omicron appears to mostly cause upper respiratory tract infections. That means the nasal passages and the area of the upper respiratory tract, which tends to affect the throat, the sinuses, and it leads to sort of mild cold-like symptoms. The variants earlier in the pandemic caused more lower respiratory tract infections, which was disastrous. It was marked by pneumonia and, of course, more serious illness, including death. So there are ongoing studies to determine if these variants have less deleterious effects on the mitochondria. Here we go, the mitochondrial effect. So stay tuned, because this is still ongoing work.
Fantastic. Well, I want to thank everyone, of course, for submitting your questions and your comments and your suggested topics for future studies to go over. They're really important to us as we all try to learn together. And thanks for that, Dr. Gonshor. Let's jump into today's study about antioxidants stimulate BOC1 dependent tumor angiogenesis.
Thank you very much. And can you all see this?
Got it.
All right. So here we go. Antioxidants stimulate BOC1 dependent tumor angiogenesis. Well, what does that mean? Well, first of all, this came out in August, so we're looking at very, very recent stuff. And we take this from very well-known journals, by the way, so one can be assured that this is very, very strongly peer-reviewed. And the authors basically said that antioxidants increased tumor vascularity, that is, created more blood vessels in the area of the tumor, and you need blood vessels to create blood movement, to create oxygen, so that you can keep those cells alive. And it did it in a BOC1 dependent fashion. It correlates with angiogenesis. Angiogenesis is the creation of blood vessels. And so they said, we conclude that BOC1 is an oxygen and redox sensitive angiogenesis transcription factor. Well, what does that mean? The one thing that you need to remember, this comes from one of the slides that I give and we discuss this, is that we know about antioxidants, and we've always considered and should consider that antioxidants are an important way in which the body itself, in an endogenous way, meaning creation itself from the body, creates antioxidants, because it is a way of being able to combat the effect of what happens when a mitochondrion is utilizing oxygen to create energy. The mere fact that it does that creates what's known as reactive oxygen species, ROS. That's just a natural consequence of creating energy. So the body says we know that, and therefore we have natural antioxidants to try to control the amount of reactive oxygen species, which will naturally be formed every second of our lives. And we also use exogenous antioxidants. We take supplements, we have them in our diets, etc. Everything from vitamins, B-carotene, glutathione, etc. The list is endless of what we use as antioxidants. And we know that preventing and managing oxidative stress is an extremely important part of our metabolic life. So healthy lifestyle choices are extremely important. None of this changes. We know that, from a balanced diet to smoking cessation, regular exercise, stress reduction, less chemical exposure, less alcohol intake, adequate sleep. Hello, these are things that we know very well. Do we do them all sufficiently? No, but that's what you look for in healthy lifestyles. And one of the other things is all of the different antioxidant supplements that, as I said, are either endogenous or we're taking them as supplements. And they do work, and they work well in many cases. But like everything in life, there is both a good side and a dark side to everything. So here we're discussing antioxidants and blood flow stimulation in tumors. And it has been known for a while that vitamin C and other antioxidants, remember, vitamin C is a very strong antioxidant. They stimulate the formation of new blood vessels. That's angiogenesis. And it creates increased blood flow in general to many tissues in the body. That's good, but also to tumors, including not just benign tumors, but malignant or cancerous tumors. So it corroborates the idea that some dietary supplements in some individuals, in some situations that contain antioxidants can accelerate tumor growth, and with that, metastases, or the movement of these cancerous tumors into the area where they are primary tumors into other areas of the body, which of course is what you want to prevent. Metastatic tumor situations is, to say the least, not good. So they said it's surprising. They were surprised, since it was previously thought that antioxidants across the board have a protective effect, which in many cases they do. And I want to make that clear. I don't want people to say, whoops, no more antioxidants. That's not the case. But in some cases, the new blood vessels will nourish the tumors and can help them grow and spread. And so, as I said, previous findings show that antioxidants like vitamin C and vitamin E can accelerate growth and spread of lung cancer, for example, by activating a protein that is called BOC1. BOC1 is activated when the level of free oxygen radicals drops. For example, when you have extra antioxidants via diet, or when spontaneous mutation in tumor cells activates endogenous antioxidants. So remember, BOC1 is normally activated when the level of free oxygen radicals drops. The new finding is that activation of BOC1 does what? It induces angiogenesis, the creation of new blood vessels. So while low oxygen levels have traditionally been known to be needed for new blood vessels to form, why would they form? Because, whoops, there's low oxygen, not enough oxygen is getting to the tissue. Let's form new blood vessels. Well, we know that these low oxygen levels have been needed for angiogenesis to occur in cancerous tumors. This new mechanism demonstrates that these tumors can also form new blood vessels in a very perverse way. They can form these new blood vessels in the presence of normal oxygen. Normal oxygen normally shouldn't trigger this, but it does. And so what is the therapeutics here? BOC1 control may offer new and more effective ways of preventing angiogenesis in tumors. And remember, this is for a particular group of patients. For example, patients whose tumors exhibit high levels of BOC1, that is a clue. They might benefit more from angiogenesis therapy than patients with low BOC1. So if people with low BOC1, you may not need to worry. But if you're seeing a person who has the tumors and at the same time very high BOC1, you say, wait a second, maybe we should be inhibiting that BOC1 because it is creating blood vessels that are going to make that tumor grow even more. So the next step, these authors say, is to examine in detail how levels of oxygen and free radicals can regulate the BOC1 protein. And we'll do similar studies in other cancer forms, such as breast, kidney, and skin, because remember, they were working in the area of lung cancer. So what are the key takeaways? Vitamin C and other antioxidants stimulate the formation of angiogenesis, which, by the way, is normally quite good. But in some cases, it creates increased blood flow in tumors, including cancerous tumors. And the mechanism, it's the stabilization of a protein called BOC1, which is activated when level of free oxygen radicals drop. Antioxidants neutralize free oxygen radicals, that we know. These radicals can damage the body and are therefore commonly found in dietary supplements. But in overly high doses or their use in certain conditions, for example, people with BOC1 in high levels, can be harmful. So it's really just a cautionary tale. And again, it shows you the issue of metabolics here.
So I was asked years ago, or was told by someone, that they said our antioxidants are the most powerful thing in the world, whatever it was, A, C, E, K, and I said, well, is that a good thing? is it possible to take too much antioxidants? And the salesman looked at me with kind of a stunned look. No one had ever asked him that before. And I thought, well, it's a pretty good question, don't you think? So I've looked into this study, and yeah, you can take too much of a supplement. That's true. Almost probably any supplement if you looked at it hard enough. And you know, I've said for years that FDNs work with people who have all kinds of conditions, but when it's cancer, they have an oversight. They have an oncologist or someone on oversight who can check some of these things out. You know, the potential harm, because we would never want to do that to anyone. But I also checked and could not find any study on, matter of fact, all the studies on food and cancer suggested that fruits and vegetables, which are very high in antioxidants, are actually good for people with cancer. No, I studies show that the food, which is where we tell people to get most of their vitamins and minerals from if they can. And so I just wanted to make that point.
Listen, it's very important. And I think I said before, and I think we need to stress again, I don't want people to say, well, wait a minute, whoa, antioxidants. Well, I'm not going to suggest that for, any of the people that I deal with. No, that's not the message. What the message is that as we move along and look at objective scientific evidence, it's a process. And this process here is saying, guys, there may be certain people at certain times, especially those with high levels of BOC1, and there will be other proteinaceous substances like this that there'll be tests for, and you will see whether or not you should be doing it for those people. And I think it's just a cautionary tale, like everything else. I think, as you just said, it's too much of a good thing. And when there's too much of a good thing, you're going to say, whoa, wait a minute, there's a dark side to this. And this is just giving you a bit of a focus on what some of those dark sides are.
Absolutely. And I'm glad you mentioned the testing, because we test for oxidative stress in every client or patient. So we're always checking out, and we don't see a lot of it, but if we do, we know that excessive oxidation could actually be what they're doing that they think is remedial. So very, very good study. Thank you, Dr. Gonshor. If you like this episode, please subscribe, like, and share. And submit your questions, comments, and suggested topics for future shows to fdntraining.com/science matters. And if you want a copy of the studies that we went over today, fdntraining.com/studies. So thank you very much. Join us again in 2 weeks we're actually going to talk about the gut microbiome, mild cognitive impairment, and probiotics. This is a randomized clinical trial in middle-aged and older adults. And who comes into FDN practices, but that demographic, of course. And the reason we do this, as you well know, is because science matters.